Good afternoon, everyone. Welcome to part one of a four-part series regarding AMCs, a model for success. Today, we'll be discussing debunking the myths and defining success of the AMC model. Our speaker today, obviously we'll have a brief introduction of Michael. He will then define the AMC model, identify the services provided by AMCs. He will profile an AMC managed organizations or profile AMC managed organizations, and then also discuss measuring successes experienced by AMC managed clients, followed by a brief Q&A. So today we are pleased to have with us Michael LoBue from LoBue Majdalany. Michael brings management experience in a wide range of sectors and market areas, including a master's degree in management and public policy. Michael has been working in the practice of association management and governance through the AMC he founded 25 years ago. Michael has also been serving on boards of directors since before starting the firm in 1993. Today, Michael will present the first of four SALA webinars on the AMC model. The following webinars will be presented by three other SALA AMC partners. Today's presentation will cover a clear definition of an association management company, the typical services provided, results of some studies Michael has conducted in measuring and evaluating the value proposition of the AMC model. Michael will keep his remarks for about 20 minutes, after which we'll have plenty of time for questions. As Rich said, if you have any questions, you can enter them in the chat box or in the Q&A function as well, which is on your navigation bar. So with that, I will turn it over to Michael.
Great. Thank you, Kevin and Rich. And those of you who were who've joined us today, appreciate, you have a busy schedule and really appreciate you joining. The AMC model is actually not that new. The first identified AMC was in Philadelphia in 1885, and it continues to operate today. And here is the sort of textbook definition that the AMC Institute, which is our trade association, has come up with, and everyone seems to have accepted. By and large, with only a few exceptions, AMCs are for-profit professional service firms, and there are a few large associations or societies that provide association management services for chapters or other allied entities in their particular industry or profession. There are about, it's hard to know exactly how many AMCs there are practicing in the United States. There's about 200 dues-paying members at the AMC Institute. And full service clients get basically three things, and many more, but that starts with three things. The AMC managed client boards completely avoid the legal and operational responsibilities of being an employer. It can't be sued for employer-employee related violations because they have no employees. They also don't have to spend their scarce time searching for staff, investing in professional development of staff, etc. They also do not have to enter into leases, shouldering the full cost of occupancy. And unless there's a special need, they don't have to spend their scarce revenue on capital goods, furniture, furnishings, computers, software, etc. So that's the high level. So in looking at, generally speaking, these services are provided by virtually all AMCs to one measure or another. The headquarters service, our office, for example, is headquarters to our 6 clients. It's where we file the letters, articles of incorporation, their annual state filings, etc. It's the official nexus of the organization. Management, executive director, CEO, executive vice president, whatever the title is, it's a chief staff officer. Accounting and finance, some technology services, membership administration, excuse me, marketing, that's broad, but a broad umbrella, but marketing services, meeting event planning and support, as well as, in some cases, formation and startup of association. I think another element, another value add that AMCs bring is that we invest, and not, again, I'm not just talking about our firm, but I know this to be the case for many others. We invest a fair amount of time in getting to know the third-party service provider community. And here are some examples of just some of those third-party clients. So when a client comes up with a need, we either have that solution, if it's not within our particular portfolio of services, we may already have that service in play by a third party working for another client of ours. Or we have ongoing relationships because we invest in that time to pretty quickly find what that need would be. And so here's just an example of some of the other services that we might go out to. And then sort of lastly, in the area of defining the AMC, in 2004, the AMC Institute created the AMC Accreditation program as a way to differentiate AMCs. Our firm, L&M, LoBue Majdalany Association Management, is a charter accredited firm. A charter accredited firm isn't a better accredited firm than a regular accredited firm. It just means that we jumped into the water soon. We got our accreditation the first year it was made available. Same standards, same requirements for qualifying, same requirements for keeping it current. It is also not a guarantee that you're going to get better service from a charter accredited or from an accredited AMC. Some would like to tell you, let you believe that, but it really depends on what you need. And it is a tool for you, for not just for you, because I don't know who's on the call, but for association boards to determine whether or not that level of commitment by an AMC is something that's of value to them. And when we look at the raft of RFPs that come through over the course of the year, there's a slight increase in the number of boards that are looking for accredited AMCs, but not all do. But to keep in mind, and I think what distinguishes an accredited AMC is that we have to pass a 65-point inspection to obtain the accreditation. And then every 4 years, in fact, ours is coming up in 2 months. We had just scheduled our auditor to come in for our next renewal. But we have measurable performance systems, formalized client association communications, ongoing training and education for our staff, extensive and verified financial controls that are GAAP compliant, not only for our own operations as a firm, but on behalf of our clients. We have comprehensive insurance, and again, we have to show proof of best practices compliance by a recognized third-party auditor. So it's a way of, again, differentiating those who have made a rather public and an investment. It costs money to demonstrate this level of service commitment. So now I want to get to a few slides there, a couple of slides actually, that will answer some questions about, well, who are AMC managed clients? And these are all full service clients as opposed to some standalone organizations that might outsource certain operational functions selectively for their staff. One of the first myths that I heard some years ago is that, well, AMCs are good for incubation. But when the organization gets to be a certain size, but nobody could really say what that mythical size was, then they need to grow up, put their big boy pants on, the big girl pants on, and get their own, staff. Well, to answer that question, I took a look at, now this is a pool of almost 100 associations of that are standalone and about 100 that are AMC managed. And actually, it's the data set of something else I'm going to show you in a couple of slides. And I just looked at the age of the organization and how long they've been with the AMC. They were presently with an AMC when we took this measure. They could have been standalone, gone to an AMC, been at an AMC, gone to a standalone, switched around. But I would say, and I'd certainly, if you've got questions or comments, and be happy to take these afterwards. If that representation were true, that the AMC is predominantly good for incubation, I'd expect the average age to be 10-ish. Again, average. But we've got an average age here of this group of 34 years, which is, 75% of the length of time of the standalone pool. And if you look at the tail end of that graph, that column chart, you'll see the blue columns are the standalones. There are the 4 oldest organizations, 3 of them are AMC managed. So, age of the association doesn't appear to be a big differentiator between the group. Now we're looking at a profile of AMC managed clients according to the organization's primary interest or industry sector. And we see, with just a few exceptions, that basically the profile of AMC managed organizations pretty much matches the profile of the larger standalone group. The healthcare and medical is a little bit of an outlier. Now, again, what we're looking at here is, let's look at the healthcare and medical sector. So that's about 26% of what? It's 26% of the sample pool. So 26%, if we were to extend this out, of AMC managed organizations are somewhere in the healthcare medical field, which is not surprising given how large healthcare is as a sector of the economy. And business and commercial also tends to favor, at least in the profiles, AMCs, and then education is the other way around. But I think by and large, this says, they're pretty much the same kind of organizations. Now we're going to look at how the AMC model measures up, and sharing these results in the past, especially when they were published, I had a few targets on my back because people were alleging, well, you have a vested interest in having the AMCs look good. And I said, well, I actually don't have a vested interest in the AMCs looking good. I have a vested interest in the AMC model being measured and positioned accurately, because if there's such a thing as an association that's not well suited for an AMC, I certainly don't want them as one of our clients. And I don't know another AMC that does either. So we're really looking for moving this perception away from anecdotal experiences into a more data-driven and evidence-based model. So these results come from a comparison of the ASAE operating ratio study that happened to be published in 2008 of 2007 data, and the AMC Institute operating ratio study of AMC managed clients. And I'm sorry, if anybody really wants to know, I can send the studies or I can get the specific answers. But I'm recalling that the sample size for ASAE operating ratio study up to $5 million was something on the order of 600 or 700 associations that gave data that year. And it was somewhere in the neighborhood of about 300 that AMC managed organizations presented their data. So what we're looking at here in terms of this 50% premium that standalones would face versus hiring an AMC, I want to be real clear what that is. If you look at, and this is how the measure was done, full compensation cost, including taxes and benefits for staff, full occupancy cost, and other direct cost that a standalone organization has to shoulder that would otherwise be blended in to the retainer fee that an AMC would charge, right? So that's the substitution. And what we're looking at here is about 33 maybe percent, 32, 34% was the average cost of revenue that AMC managed organizations paid, as compared to the summation of all those other costs that a standalone paid of revenue. Where it was about 50% for standalones, and it was, there was about a 15, 16 percentage point spread. And so that was the difference. That's 16% percentage points over 32. It's roughly 50% is the average premium that they would face. And then we also looked at a comparison of the three performance metrics that the operating ratios like to report, which is net profitability, operating efficiency, and operating risk. And in each of those cases, the AMC managed population outperformed the standalone model with higher net profitability, higher operating efficiency, and lower operating risk. Lower operating risk is a good thing. AMC managed organizations also had more diverse revenue profiles than the standalone comparison. And the AMC managed organizations had higher percentages of revenue spent on meetings, trade shows, and educational activities for their members than did the, that's odd, than did the standalone model. So next, couple more slides here, and then we're going to be done. This is a 10-year longitudinal study, and it was precipitated by an article in October of 2009 by CEO Updates, where if you look at the three first data points on this graph, the gold ones for 06, 07, and 08, that's exactly what was in the CEO Update article. And the report was that the recession just knocked the crap out of the association market. So I called the author. I said, "Do you have any AMC managed organizations in that?" And he said, "No, actually, we don't, because these all come from our client base. And CEO Updates, as many of you may know, actually does executive searches for the association sector." So I said, "Well, what do you think it would look like for AMC managed?" He says, "I don't know, but it'd be interesting." So I thought, well, we could find that out. I'll just pull the 990s for as many association standalones as I could find and many AMC managed I can find. And I went through his database, their database, and I looked for organizations in their database that were below $5 million in operation at a fiscal year end of December 31. And I went through the AMC Institute membership roster and ended up finding 40 AMCs who identified clients on their websites with fiscal years ending December 31. And those population numbers were, in 2006, 111 AMC managed and 97 standalone. And I pulled 990s for that, both of those groups, for 10 fiscal years through 2015. And the sample size for AMC managed dropped to 93. Some organizations went out of business, some changed their fiscal year, some got merged out, one or two switched to standalone, and then the standalones dropped about 8. What's that, like 9% or so, 7%? Again, same thing. There's a couple of them switched to AMCs, a couple of them changed their fiscal years, merged out, went out of business, what have you. But so it's essentially the same two groups. And the AMC model seemed to have been more nimble in the ability to respond to the same general economic conditions. And with 40 AMCs involved, you can't say that there was a particular AMC practice that kind of bias these results. So, there you have it. And the revenue sizes for AMC Managed, the minimum was 57, the maximum was 9.4 million, because we had a number of them that blew out the size. And standalone went from 229 to 9.8. So, again, it's not a statistically significant comparison, but this gives us some idea of what we're looking at. And again, the majority of AMC Managed clients tend to be kind of the profile of under 2 million, the SALA small association group. So I've been asked, what do you think accounts for this, Michael? And my answer is, well, I have my educated hunch. I can't figure out a research methodology that would, get these results that would be data, evidence based. But I think it goes back to the two core differences and two core factors of the AMC model: the economies of scale, the effective sharing of resources, that's occupancy cost, right sizing of staffing models, personnel training, development, etc. And something that, and this is my term, economies of scope, which is for AMCs, we manage multiple clients simultaneously. So every one of our clients is benefiting from lessons learned, both successes and mistakes, from every other client we manage. And in a lot of cases, no staff member, this is not 100% true, but in a lot of cases, no one AMC staff member is working with just one client. They're an executive director for 2 or 3. They're doing finance and accounting for a group. They're doing marketing. They're doing member management. And so there's a richer, more robust learning curve about how to address opportunities and challenges. And now we're at the Q&A. Thank you all for listening.
All right. Thank you, Michael, very much. Rich, do we have any questions?
Yeah. So one question, Michael, since you managed, you sort of addressed the idea of going away from the management model as an incubator into a self-managed association. Under what circumstances would you want to revert back from self-managed to an AMC approach? And what are the considerations for doing that?
Well, I'm going to thank you for the question. I'm going to start with my standard reply. Just about any question in the association space, whether it's AMC or not, well, that depends. And so I think what you're asking is, so what are the issues? What are the dependencies? I haven't studied this, but I have some experience with this, and it's where, in fact, we've got one client right now that's kind of betwixt and between. They have their own staff. 5 years ago, they hired us for executive management. The lesson they learned was they really didn't know how to hire a chief staff officer. They hired one, went through this elaborate process, loved the process, but it failed. And the person they hired was a good, experienced exec. It just wasn't the right fit. He lasted about 15 minutes. And then this board went back to a consultant they used to help them sort of figure out, what their needs were, what their strengths and weaknesses were, and he suggested looking at an AMC. So it was an experiment for us, but we provide just association executive management. And they're talking about, well, should we just have you hire our staff and do away with the office? Or what would you do that? And so we're discussing that. And I think the right, I guess as I kind of wrestle with this answer, is that it really needs to be based on, will you get the kind of performance you want, you need, you think your members have? Will the model will a change in the model help you as an organization provide a better and stronger impact? Now, maybe it's cutting costs. Maybe it's having access to other services. Maybe it's having access to more flexible and nimble services. So there's a number, there's a number of ways to look at it, but I would say it really needs to start from, is this going to help us? Is this going to be a strategic benefit for us moving forward? And when you figure that every member of a board of directors is part-time, and not all of them are really strong in the particular area. They may be very, leaders in their particular industry or field, but they don't necessarily have the right background in association operations. And while we don't expect them to do operations, we do want them to have enough of an appreciation so they can at least hire the right chief staff officer and let that chief staff officer, bring in and manage the rest of the resources. So I'm happy to take a follow-up question to that if it didn't answer your question, but I think it really begins with, will the model and will the AMC you choose contribute to strategic improvement in what your organization wants to do?
Yeah, it's really interesting because I know with a lot of smaller organizations being resource challenged, and we did a survey earlier in the year that indicated a fairly high ratio actually were hybrids, with some office staff and some offsite staff and consultants and all that. So I think AMC's kind of fit into that mix too. So I appreciate that. I do have another question here for you real quick. How do you see the low unemployment rate across the country affecting the AMC model and standalones?
Good question. It's hard for me to answer that for other markets, but I might be in one of the perfect markets to answer that. We're located in San Francisco. The firm's always been in San Francisco. We've had remote employees for more than 20 years. So we have a lot of experience with that model. The cost of doing business in San Francisco is high. Part of that is occupancy. The other part of that is staff and salary. I would say that we've had an exceptionally stable staffing model. I don't know what our average is, but I don't think we've had anybody. We have one employee that's been with a single-digit number of years because he was a recent hire. But I would say that for the AMC model is that it can be perhaps more appealing for staff because there's more variety for the work that they do. And I think it can be, to the extreme, a real solution for either a chief exec who's employed by an organization or a board say, that's not our worry. We just don't have to worry about it because we're contracting with the AMC for a scope of services. So it's up to the principal or the account exec at the AMC to worry about that. And I think we as an AMC have more tools and more variety available to attract and keep either staff or, and some use, steady and stable consultants. So that's my answer. I'm sticking to it until I change it.
Huh. I think it might be, this is Kevin, by the way, I think it might be interesting for the smaller associations that are standalone with the improved economy to maintain staff who are looking to advance their careers, because I would think that larger associations would be hiring as they grow, as their dues base would grow. So that would be my thought, just from a standalone small association management perspective. I think, Michael, your point on AMC's employees having a more diverse work experience is well made as well.
Yeah.
But it is.
And I might add, we're looking at a situation now where we've got this individual I mentioned who's been with us about 4 years. He's on his CAE track, and we have a requirement in our firm that you cannot be assigned to be a chief staff officer for one of our full service clients unless you either have your CAE or you're on track to get it. And again, no guarantees, except it's an unambiguous statement by the individual that association management is a proven career path for them. So I think AMCs also offer more paths and flexibility for staff to grow on a career path in associations. And if we've got a staff member who comes out of the batch working for client A because for whatever reason they're doing more work in client B and C, well, they're not lost. That experience and access to that person is not lost to the client or to the staff that are now working with the client. So, there's a lot of these nuances that I think folks don't necessarily appreciate that come with the classic operation of an AMC. So, thank you.
I have a question for us, if you will.
Yeah.
We're doing a number of studies this year, and in the fourth quarter, we're doing a benchmarking and ratio study, similar to the ASE study, but we will only be doing it for small associations. And I had not thought of it until your presentation today as to whether or not one of the questions should ask if you are an AMC managed or standalone entity. So we could then differentiate between the two within that study. I imagine you would recommend we do that.
I absolutely would. And I would also recommend that you ask, are you, and we'd be happy to give you some input and help with the definition, but, are you fully standalone? Are you a hybrid? Or are you fully AMC managed? And I think that would be very, very important.
That's a good point as well. And trying to define all that, we have had some trouble, even just with our benefits study, and just in trying to, if you're a virtual office, if you're standalone, if you have one or two staff but use a lot of subs or whatever the model is, it really impacts the answers to so many of the questions we're asking. Just trying to get good data back to all of our members and to small associations. So.
No, it absolutely does. And I think it's a more relevant question for SALA than, say, ASAE. In fact, in the case of ASAE, if 0 appears on line 5, well, on line 5 of the 990, but whatever line it is on their form, they exclude the organization from their operating ratio study, which I think is a good thing to do because they're keeping their data set, as pure as it could possibly be. And so I think it would be visionary of you guys to add that question. And like I say, we'd be happy to contribute some ideas about how to come up with common sense definitions.
We will take you up on that offer for sure.
Okay.
Rich, any other questions? Alrighty. Well, I would like to thank you, Michael, for a great webinar today, and thank you also to everyone who attended for your time. As a reminder, you can see a full list of our upcoming webinars. Here's the list.
And the next one is Tuesday, and I've got on the slide now. I have the next one's coming up.
Yeah. Here are the remaining 3 in this AMC Model series, and you can see a full list of other webinars SALA is presenting as well throughout the remainder of the year. So I'd like to thanks again to Michael, and thanks again to all of you for joining today. I hope you all enjoy the rest of your week and what's left of your summer. Thank you.
Thank you. Thank everybody for participating. Bye-bye.